Hello, my name is Christopher Duran and I want to speak about pain relief for dog arthritis. When a dog has arthritis, just like when we have arthritis, controlling that pain can make or break the overall treatment of your dog's arthritis. Pain relief in its pure form is not the first drug that we pull off the shelf. We as vets would prefer to use maybe the nutraceuticals such as the cosequins, the dasequins, any of the glucosamine type drugs. We would also more commonly use the anti-inflammatories, so Rimadyl, Metacam, Previcox, all those drugs. And we would use those ahead of the pure pain relief type medications, but there are still some pretty strong reasons to use these drugs, these pain relief drugs, on an as needed or even an everyday basis. So let's go through these drugs and we'll talk about them as classes and decide which of these drugs might be helpful for your dog, and you can have a chat to your vet about your specific circumstance. Firstly, the opioid analgesics. These are the most effective pain relief medication that we have. Simple as that. Their effects are usually dose dependent, which means that if we give a big dose of the drug, we tend to get more pain relief. But at some point, we will reach a level where we start to run into the side effects of these medications. Even though we're getting good pain relief, we're starting to get the side effects of the medication. And the most common side effects would be vomiting, maybe some breathing difficulties, maybe constipation or diarrhea. It depends on the specific opioid analgesic. Common opioid analgesics would be tramadol, codeine or hydrocodone, morphine, and fentanyl. Tramadol is the most popular of these drugs for arthritis use and in a lot of animals for post-operative use. It's not really classified as a narcotic as such, but it does act like one. And because it's not a controlled substance, at least at the moment, there's a good availability of the drug through vets, and there is currently no evidence that dogs can become addicted to tramadol in the same way that they may do to the other opioids, such as morphine. So tramadol is a fantastic drug, and we use it quite commonly for arthritis, and it works in a number of ways. The other main class of drugs that we would use are called the NMDA antagonists, and this is a little family of drugs that are very effective against what we call neuropathic pain, and that is pain caused by nerve damage. The NMDAs that we use to treat dog arthritis would include ketamine, probably least commonly, amantadine, dextromethorphan, and gabapentin. Amantadine is probably my pick. It's very effective and it's only given once a day, which I think is just a bit of a help for people. It's inexpensive when compared to the other drugs like gabapentin, although you can use these drugs together. There are also combination therapies, which is the administration of multiple classes of drugs, and what you're trying to do is to get a better benefit than each of these drugs can produce by itself. Probably the most common combination therapy would be gabapentin, amantadine and tramadol, and that's a pretty heavy duty little combination. If you're adding in all the other drugs like Rimadyl and cosequin, then you've got a lot of medication that can make a big difference to these dogs. Another combination is called MLK, and that stands for morphine, lidocaine or lignocaine, which is a local anaesthetic, and ketamine. And this is an intravenous infusion, so it's not something that you would be doing at home, but if you've got a dog that's in a lot of pain and nothing else is really working, then the 24-hour infusion of MLK can make quite a difference, just to bring down the level of pain in the spinal pathways, and then once you've in effect reset those spinal pathway levels of pain, you can get back onto the normal drugs. So there's a place for that, but it's not used very often. So if your dog is suffering from the pain of arthritis, and specifically if your dog is already on an anti-inflammatory and it's on Cosequin and you're really not getting very far, then there may be a place for these pure pain relief drugs to just supplement your dog's treatment protocol and hopefully improve his mobility and quality of life. My name's Christopher Duran. Thanks for listening to this post, and please download my ebook, The Dog Arthritis Survival Guide, for more information, and visit my blog. Thank you.